Hi, I'm Michael. I'm a graduate entry medical student at the University of Birmingham. This is a less traditional route into medicine as I had to do another degree before I started medicine. But I'm going to talk to you today more generally about the medicine course, what you can expect as a medical student, what life is like for medical students, going on towards becoming a doctor and what that entails and what you need to do, as well a bit about entry requirements, what you need to do in secondary school to prepare sort of the pathway that's going to lead you into medicine. So medicine is typically a 5-year course, so longer than most other university courses. At some universities, it's even 6 years where they make you do what's called an intercalation, where you basically do another degree for a year. At some 5-year universities, you can also have those as optional if you decide you want to do that. So your 5 years of medical school are split into what's called preclinical years and clinical years. Your preclinical years is where you'll spend most of your time in university, learning about the physiology of the human body, so learning almost from head to toe how the human body works, what underlies health and disease, how it functions, those kind of things. And you'll also learn things like anatomy, so that's the structure of the human body, your blood vessels, your bones, all those kind of things. So during the preclinical years, you won't just be learning about the biological side of medicine, health and disease. You'll also be learning lots of important other things like public health, morals and ethics, which are really important in making decisions as a doctor. You'll start to get a feel of the roles and responsibilities of a doctor, what will be expected to you as a medical student in your clinical years. You'll learn lots of other important skills that you need to take forward, such as communication skills, presenting, those kind of things. At most universities, though, the preclinical years won't be devoid of patient contact. They'll also give you a chance to see patients. So at Birmingham, we start as early as sort of week 5, week 6, by going into general practice every other week, where we get to experience what the GPs do. We get to have our first patient contact. We start learning how to take a patient history, which is really important, how to do some basic clinical examinations that sort of start to build our confidence and our skills and our knowledge for going into the clinical years in hospital. So when you go into the clinical years, this is when you'll be on the wards learning directly from doctors and from patients as well. You'll have kind of left the books behind in your preclinical years, and you'll be learning practically, seeing patients every day. You'll be in hospital kind of Monday to Friday on the wards, learning as much as you can by sort of seeing different cases, by seeing different patients, as well as through simulations. You'll also start building up your core skill sets that are required for being a doctor. During this time, you'll rotate between different hospitals, and you'll get to experience a variety of different clinical settings. You might be in the different specialities such as cardiovascular, respiratory, psychiatry, etc., seeing a sort of mix of medicine as well as surgery during this time. After 5 years of medical school, having done your preclinical years in university and your clinical years out in the hospitals, you're finally qualified as a doctor and you finish university. This is when you're able to use the doctor title after you've registered with the professional body for doctors called the General Medical Council, or the GMC for short. And this is where you then go on to become a junior doctor. You have to do 2 years of sort of compulsory training called your foundation years. And these are often shortened to FY1 for the first year and FY2 for the second year. So during this time, you're paid for the work you do, but you basically rotate between different specialities. Each of these placements are about 4 months long, so you'll do 6 over the course of the 2 years. After you've finished your foundation years, this is where you choose more what kind of doctor you want to be, and you go into your speciality training. This can take up to 8 years, depending on what you choose to do. There are kind of 3 main areas that people decide on. That's being a surgeon, being a physician, and both of these tend to work in hospitals, or being a general practitioner or a GP working out in the community. Throughout your speciality training, there are exams that you have to pass and lots more learning that you have to do. And it's only once you've finished this speciality training that you're considered a senior doctor. You can work more independently. You become either a consultant or a GP, depending if you decide to work in hospital or general practice. Even when you become a senior doctor, the learning and development doesn't stop. You constantly need to be improving your knowledge base and your skill set, trying to become a better doctor. You also need to keep up with what is a very fast and rapidly changing field. Things like learning about the latest treatments or understanding the latest, ways of diagnosing patients. Medicine is a career where you will always be learning, and for some people that might not be something they want to go into. For others, like me, I find that really exciting, that I'll constantly be learning new things and I'll never get to a point where I know everything, because there's always going to be someone that knows more about an area of medicine than me, or someone that's found something new. So you'll constantly be developing your skills and pushing on your knowledge, and that's something that you have to decide if it's for you, because it is a commitment to the rest of your life to be learning and to be working in a job where that is required. What is the reality of being a medical student? Medicine has a reputation for being quite a tough, challenging, and difficult course, and this is true. It's a course that requires a lot of hard work, has a lot of hard, long hours, and there's a lot to learn in the 5 years while you're at medical school to adequately prepare yourself for becoming a doctor. Being a doctor is a very stressful job at times, because you are responsible for people's lives, and medical school to an extent reflects this, that it can be quite a stressful, hard environment where it requires a lot of hard work. You will see things that are at times distressing and difficult, and you need to learn to overcome these challenges to prepare yourself properly for becoming a doctor. Saying that though, medicine is an incredibly enjoyable degree to study. Learning all about the human body, how it works, where it can go wrong, how you can treat it, how you can make it better, is something I really enjoy and get a lot of satisfaction about being able to understand. It's also a really rewarding degree to be involved with, and it's enjoyable while you're learning it, because you're getting to work with people. You're getting to be with people at some of the most difficult times of their life. You get to bring joy to people by helping them and being involved in their treatment. And that brings a lot of satisfaction and reward to the degree that makes the hard work that is required worth it and enjoyable. There is still time though to get involved with other aspects of university life, such as sports, dance, music, and the sort of different societies that you see at university. Because medicine does have a sort of different schedule and our times vary, especially when we're on hospital placements. We have a lot of our own societies, so we put on our own shows, we have our own sports teams, we have our own societies that you can join, our own charities and different things like that, to sort of cater for the needs of the medical students. But this doesn't mean that you can't get involved with normal university life, so in that sense you get kind of the best of both worlds, being able to be involved with the normal university and also having these other opportunities that are kind of more for the medical students and the healthcare professionals to be involved with. Ultimately, I'd say that the reality of medicine is that it's a difficult and challenging course, but also incredibly fun and incredibly rewarding. And I have absolutely no regrets about studying it so far. And despite the occasional long days, I enjoy almost every minute of it. How do you get into medical school? Well, you need to apply to a medical degree at university, and this typically happens in year 13. I'm going to talk about the entry requirements and the things you need to do in order to prepare to apply for med school, but these are obviously always subject to change, and the best way to find out this information is to go directly to medical school websites by searching through Google or going to the UCAS website to find out more about applying to medicine. But right now I'm going to go through what sort of typically is expected and kind of where the entry requirements are at the moment for most med schools. As I said, getting into med school starts right from your GCSEs. Typically, med schools expect a minimum of a 6 or B grade equivalent at GCSE in 7 different subjects. These are usually expected to be in English language, maths, chemistry and biology, and then any other subjects to make up the 7. Your GCSE grades are often ranked, so getting higher scores than the minimum is always a good idea, as it will give you that kind of competitive edge when you're applying for med school. After your GCSEs, the A-levels you choose are very important for getting into medical school. Most medical schools will ask that you've taken chemistry at A-level, and some will ask that you've also taken biology alongside that. But often what you'll see, and the kind of standard for most medical schools at the moment, is that you've taken chemistry and either one of biology, maths or physics as your second A level, and then they generally don't mind what you do as your third A level. So it could be one of the science subjects that you haven't chosen to take, or it could be anything from history, maths, drama, etc. In addition to your A levels, most medical schools that will ask that you've sat one of the two admissions tests. These are the UCAT, formerly called the UKCAT, and the BMAT. These are slightly different tests, and if you'd like to find out more, I'd recommend going to the websites for the UCAT and for the BMAT to kind of look more into what they are and what they entail, as they do differ slightly. Most medical schools at the moment ask for the UCAT, and I think about 6 different medical schools, including Oxford and Cambridge, ask that you take the BMAT instead. They only ask that you take one of these two medical admissions tests generally. Work experience is a key part of applying to medical school. It's not just important for your personal statement that you have to write when applying, but also for helping you decide if a career in medicine is for you. Medical schools appreciate that getting work experience in a hospital can be difficult, especially whilst you are in secondary school, and for the most part do not disadvantage students that do not have hospital experience. Some hospitals will have work experience programs if you look on the websites that you might be able to find, but lots won't and won't take people under the age of 18, particularly secondary school students. Care or voluntary experience is important to try and obtain, and I'm going to briefly touch on some of my recommendations for getting this, as it might be easier than you think and can help make you stand out when applying for medicine. It can give you a good insight into caring and help you decide if a healthcare career is for you, as well as give you a chance to develop the skills that are important for being a medical student, doctor, and for interviews for medical school. Across the country, there are lots of care homes, and they are always looking for help looking after their residents. I'd recommend going on the internet and looking at what care homes are in your area. Usually they'll have their contact information on their website. I'd advise calling them up or emailing them saying, I'm a secondary school student, I'm interested in getting some care experience and would love to volunteer with you. This kind of volunteering might involve helping at meal times, talking to residents, or things such as putting on games or activities for the residents. Don't be disheartened if you don't get experience at the first care home you contact, as sometimes you might have to speak to a few before you find one that takes you on as a volunteer. There are lots of other places you can apply as a volunteer, including some hospitals, charities that work with children with disabilities, and other care settings. I myself worked in a pharmacy and volunteered in a care home when I was looking to apply to medical school. Ultimately, through your work experience and your preparation in applying to medical school, you need to understand what it means to be a doctor, what the role of a doctor is, the challenges and the difficulties that might be faced by doctors, and have a good awareness and appreciation of those. It's also good to be able to demonstrate that you have care experience and that you know sort of the challenges and how to look after people, as this can really help you to stand out from people because you've got that frontline experience working in a care home or a hospital or whatever setting you manage to find some work or volunteer experience in. Choosing which medical school you apply for is important, as they have different teaching styles. The main two styles that you will see are conventional lecture-based teaching, where you'll sit in lectures and have tutorials, versus problem-based learning, or PBL, which will be given cases and problems and expected to learn around these. PBL is a more independent learning style compared to the normal lecture style, and you will have to decide when applying which you feel best suited to. There is also a difference in the way that anatomy is taught in med school. During anatomy, you will look at the bodies of people that have passed away and have asked for their bodies to be donated to medical science. These are called cadavers. You'll examine these bodies in one of two ways depending on the medical school, either by prosection, where bits of the cadaver are pre-prepared and you go and examine them under supervision, or by dissection, where you will dissect or cut up the cadavers yourself under the supervision. This is something important to consider when choosing which medical school to apply for. Once you've decided on the teaching styles you like, the way you want to be taught anatomy, and the different kind of admissions test, entry requirements, and location in the United Kingdom where you want to apply, you apply to med school through UCAS. You put down 4 different choices, and if you're successful, you may be invited to an interview. Medical schools then have 2 interview styles that they might do, a more conventional panel-based interview or a multiple mini-interview called an MMI. In an MMI, you rotate between different stations that test different skills and look at why you've chosen to apply for medicine. At interview, they'll expect you to have an understanding of what it means to be a doctor. the roles, responsibilities, as well as the challenges you might face. They will expect you to understand about the multidisciplinary team in healthcare and what it means to be a doctor working within this. They'll also expect you to understand some of the challenges that the NHS faces and maybe even suggest solutions for how to overcome or approach these. Furthermore, they'll assess your communication skills and decision-making skills, as well as your insight and empathy. You're expected to talk about your work experience, both within and outside healthcare settings, and importantly, what you learned from these experiences. Upon completion of your interview, if you're successful, you'll get an offer, and provided you meet that offer, you'll be off to medical school. Medicine is a fantastic course to study at university, and being able to have the opportunity to become a doctor in the future is both an exciting prospect and a privilege. I'd strongly encourage you now to start reading up on more about being a medical student and being a doctor to find out whether it's for you. I'd also start looking into getting some care experience and developing your skills if you haven't already. Good luck if this is a career that you do decide to follow, and hopefully I'll see you on the wards in hospital one day.